Students, in this video I am going to explain about the function of the hip joint. So under this, the first one is your motion of the femur on the acetabulum. So as we know, our hip joint is composed of femoral head, which is convex in shape, and acetabulum, which is concave in shape. Okay. So the movement of this, it depends on concave convex rule. Okay. Now what is concave convex rule? I'm going to explain you now. Okay. Suppose these are the two structures. This is your concave, this is your acetabulum. Okay. And this one is your convex surface, which is your femoral head. Okay. When the femoral head is fixed, means the convex surface is fixed, then what will happen on a fixed convex surface? When a concave surface will move, okay, suppose the acetabulum is moving upward, then what will happen? The entire bone is moving upward. When it is moving downward, the entire bone is moving downward. Means in whichever motion we are doing, the entire bone, it will move in a same direction. So this means this one. Okay, the pelvis will move in the same direction of the movement. Okay. Now next is when the concave surface is fixed. When the concave is fixed, and on a fixed concave surface, when the convex surface have to move, then what will happen? When we are moving this convex surface, what will happen? See, the articulating this surface, this is moving downward, but the distal end of the bone, it is moving forward, okay, or upward. And when it is the articulating surface, when it is moving upward, the distal end of the bone, it is moving downward, opposite. Okay. So when we move a convex surface, which is your femoral head, which is convex, it will always move in opposite direction of the movement. Okay. So when we are moving this convex head downward, then the distal end, the bone, that is moving upward, and when we move the head upward, and the distal end is moving downward. So this is convex concave rule. Okay. Now this pelvis will move in the same direction. Now when this movement will occur? So when we are in a weight bearing position, means in a closed peg position. Okay. So means when a person is standing erect and he is just moving forward. Okay. So at that time what will happen? The femoral head is fixed, only the pelvis is moving. So at that time, when the person is moving forward, means he is flexing his hip or lumbar, so that time the pelvis will also move forward, means the pelvic will tilt anteriorly. Okay. The next is when the femoral head will move in the, now this will occur in which position? In non-weight bearing position. Okay. Suppose the person is in standing position and he lift his leg forward, okay, or backward. Or suppose the person is in supine position, he lift his leg upward, okay, upward. So at that time this motion will occur. So at that time what will happen? The concave part, means the acetabulum, means the pelvis is fixed, only the femur is moving, so the femoral head is moving. Okay. So at that time the opposite direction, the femoral head will move in opposite direction of the movement. Okay. When the person will lift his leg forward, so what will happen? The head of the femur, it will glide or it will spin, it will glide or it will spin posteriorly. Okay. So in flexion, this one, and in extension, opposite femoral head, it will spins anteriorly. Okay. So this thing, okay, this thing is based on this concave convex rule. Okay. Now this part is also like depend on this. So what is this? The femoral head will glide within the acetabulum in a direction opposite to the motion of the distal end of the femur. Okay. Same I have already explained that when the convex, means the femoral head is convex, when this convex, it will move in one direction, Suppose this is the proximal, this is the distal part. When the proximal part is moving downward, then what will happen to the distal part? It is moving forward. And when the proximal part is moving forward, upward, and distal part is moving downward. So it is in the opposite direction to the of the distal end of the femur. So this thing. Okay. Now same thing, this is also based on your concave convex rule. So when we do flexion, okay, so these things, it is in non-weight bearing position, means it is in open chain kinematics. Okay. Okay, so in flexion, what will happen? The femoral head will spins posteriorly. Okay, so suppose when a person is standing and he lift his leg forward, okay, so what will happen? He is doing flexion. Suppose he is flexing his hip joint, so what will happen? The femoral head, it will spins posteriorly, opposite. Okay, and in extension, what will happen? When the person try to extend his hip joint, that at that time the femoral head, it will spins anteriorly. Okay, so this is. And in abduction and adduction and medial and lateral rotation, both spinning and gliding of the femoral head within the acetabulum is needed. Okay, so as we know that our femoral our hip joint, it contains all the 3 degrees of freedom. Okay, so means flexion and extension occurs in hip joint, abduction adduction is also occur in hip joint, medial and lateral rotation is also occur in hip joint. Okay, so all these 3 movements occur in the hip joint. Now this is the basic movements occur in according to the plane and axis. Okay, flexion and extension always occur in sagittal plane, and the axis will be the frontal plane, frontal axis. And abduction adduction, plane is your frontal plane and axis is your sagittal. Medial and lateral rotation, plane is transverse and axis is your vertical axis. So this is the basic thing. I guess everyone know this one. Okay, now next is same in the non-weight bearing position only, this one also. So when we, these are the range of joints, hip joint. Okay, now first is your, when we flexion of hip with knee extended. Okay, flexion of knee with knee extended is about 90 degree. Okay, so how will you do this one? So this is the position. Okay, a person is standing erect and he tries to lift his leg forward without bending his knee, means the knee will be in extended position. So what will be the range? It is about 90 degree. Okay, like 80 to 90 degree, that is the normal range. Okay. Now next is when the next is your flexion of hip with knee flexed. Okay, when we do flexion with knee, when we do a hip flexion with knee flexed, okay, that is the range is your 120 degree. So this is the picture. A person is standing erect and he is tried to flex his hip along with his knee and hip both are flexed. So this so this is like, this is in 90, but he can lift more till 120 degree. Okay, so this, and this motion is like why 120 degree, like why the range is increased here? Because when we flex the knee, the passive tension in the hamstring muscle, okay, they release. Okay, so that's why the person is able to do more flexion. Okay, so that's why the range is more. So and hamstring is present on the posterior compartment of our thigh. Okay, hamstring muscle. Next is your range of motion of hip extension. Hip extension means when we extend our hip. So this one, when we extend our leg on posterior side. Okay, this is the hip extension. So this is the range is your 10 to 30 degree. Okay, now next is hip extension combined with knee flexion. Okay, when we flex the, this one, when we flex the knee and extend our hip towards backside or backward, so this is restricted by our which muscle? Rectus femoris muscle. Okay, So this motion, this combined motion, this is restricted or limited by rectus femoris muscle. Now next movement is our abduction and adduction. So abduction degrees is 45 to 50 degree and adduction is 20 to 30 degree. So abduction, adduction, you know how it occur. So now abduction, it is limited by two joint muscle, that is our gracilis muscle, okay, and adduction, it is restricted by tensor fasciae lata and iliotibial band. Okay, these are the muscles which restricted this movement. And the last one is our medial and lateral rotation. So medial and lateral rotation, this is measured when the hip is in 90 degree of flexion. Okay, the range is 42 to 50 degree. Okay, this I will, for this I will attach one video. Okay, then you will know about this movement, how we will measure this medial and lateral rotation. Okay, but you just know the range is 42 to 50 degree. Now moving on to the next. Okay, in a normal gait on level ground, okay, when gait means when we walk normal in a ground surface, like in a normal smooth surface in a ground, so it requires 30 degree of flexion, 10 degree of hyperextension, 5 degree of both abduction and adduction, and 5 degree of both medial and lateral rotation of of hip joint. Okay, so when we normally walk on a level surface, our hip joint require this much degrees. Okay, flexion, extension, abduction, adduction, and medial and lateral rotation. Now when we sit on a chair, or when we are sitting on a cross leg position, or when we are climbing stairs or climbing mountain, okay, so at that time the requirement of the range is more. Okay, so at that time what will happen, the range will be increased. Okay, so this is about your motion of the femur on the acetabulum. I hope you have understood and you have got a brief idea about this. Thank you.